During the past year, sexual assault cases have been on the rise at the Adena Medical Center in Chillicothe, and nearly 75% of those cases have involved children. April is Sexual Assault Awareness and Prevention Month, and Adena has introduced 2 new programs at their facility. Stacey Saunders Adams is a trained sexual assault survivor advocate, and she joins us now in our studio. Thanks for being here this evening.
Thank you for having me, Graylin.
Now, you are a sexual assault survivor advocate. Can you tell me a little bit about what that is and what you do?
Absolutely. So as a sexual assault survivor advocate, we are the emotional and kind of information support for a survivor when they come to the hospital with sexual assault. We advocate for both children and adults. So what we'll do is when a survivor comes to the hospital, we are activated so we can offer them emotional support. I guess your kind of theoretical hand-holding and make sure that they have the information they need. We're the only person in the process that is there to just believe them and attend to only their needs.
And as an advocate, what kind of training do you receive so that you can do those sorts of things?
For the advocates at Adena, we provide 36 hours of training, training on the culture of rape and how our society tends to objectify women and kind of promote violence in some ways. We also talk about sexual violence, interpersonal violence, identifying those types of sexual assault, what reactions people might have as a result of sexual assault, and then how our advocates are expected to respond. So the role of an advocate, how to do crisis intervention, and then also self-care for the advocate, because it is a pretty challenging and draining role to have as the advocate.
Certainly. And the Southern Ohio Survivor Advocate Program was just introduced at Adena. What is that program and how does it work?
So the Southern Ohio Survivor Advocate Program is a purely volunteer-operated program. Basically, we are the resource for survivors when they come to the hospital. We offer 24 hours a day, 7-day-a-week coverage of an advocate at the hospital. Our advocates are on call. We went live on April 1st in conjunction with Sexual Assault Awareness Month. We thought the timing fit nicely, and it's a service that we haven't had in Ross County and surrounding areas for several years.
And Adena developed a protocol to see that sexual assault victims are offered medications. How does that work?
That's correct. So the sexual assault nurse examiner operates by this protocol so that they ensure that every survivor that comes to the hospital is given the post-exposure HIV prophylaxis, which they can be given even if they don't have health insurance to cover that. So now everybody who comes in as a survivor of sexual assault will get that HIV post-exposure prophylaxis.
Stacey Saunders Adams, thanks so much for stopping by again tonight.
Thank you.